Good afternoon, good afternoon, good afternoon. Happy New Year to everybody out there. Good afternoon and good evening or good morning, wherever you are watching me from. Happy New Year to all of you. I hope you guys enjoyed your New Year. Welcome to 2024. This is the first broadcast for the year 2024. I was not planning to make a broadcast today, but I decided that I think it is important to have a live broadcast on the first day of the year, which is New Year 2024. So I decided to make a live show. So you are welcome. You are welcome. You are welcome to the year 2024. All right. You're welcome to the year 2024. And I believe you all enjoyed your holiday. I believe you guys enjoyed your holiday. Okay. So we will be talking about the three chronicles. I'll be talking about today the three chronicles. What do I mean by the three chronicles? The three complications is what I'm going to be talking today. All right. The three complications is what I'll be talking today. All right. So I'll be talking about the three chronicles. And what are those three chronicles that I'll be talking today? We'll be talking about I'll be talking about blood sugar, high blood pressure, and then the cholesterol. These are the things I'll be discussing in this video. All right. So these are the things I will be talking in this video. All right. So I believe you guys are okay. Let me go. Let me check something. Um, welcome to today's program. Welcome to today's program. Um, Happy New Year to all of you. I'm trying to I'm trying to get you're welcome to today's program, the first day of the year. As I was saying, it was not my intention to do a live broadcast today. Okay. It was not my intention to do any live broadcast today. But I say, well, this is the first day of the year. All right. This is the first day of the year. It will be good to have a live uh, program today, and that is why I decided to come online, and then let's have a discussion today. Today I'll be discussing about the three chronicles. There's something we call the three chronicles. All right. I'm going to be discussing about the three complications that might come as a result of diabetics. As I said, there are people that might have the diabetic, they are diabetic, they have high blood pressure, and they have cholesterol issues. Those are the three chronicles. They are the three complications that mostly people that have diabetics have. So if you are unlucky, you might have the three at the same time. If you're unlucky, you might have two out of the three. Or if you're unlucky, you might have only diabetics and don't have high blood pressure or cholesterol. So, I'm going to be discussing about those three today. Okay, that is what I'll be discussing today. All right. So, welcome to everybody. So, I'm going to be discussing the three of them at the same time. So, I'm going to be moving from one topic to the next topic to the next topic. So, I'm going to be going in cycle because I'm going to be discussing everything today blood sugar, right? Which is blood glucose, also called blood sugar. All right. I'm going to be discussing about high blood pressure and I'm going to be discussing about cholesterol. We're going to be discussing how everything is interrelated. Okay. I'm going to be discussing how everything is interrelated in everything we're going to be discussing today. So I'll be moving in and out. All right. So first of all, we have to understand what is blood glucose. What is blood glucose? Okay. Somebody's going to say it's also sometimes called as blood sugar. What do you understand about blood glucose? Also at times called as blood sugar. So blood glucose or blood sugar is the main sugar found in your body, in your blood. It is the main sugar found in your blood. It's the main sugar found in your blood. It is your body's primary source of energy. Okay? It is your body primary source of energy. I said it yesterday in my video. Your body is like a car. I always use that example. Your body is like a car. All right. Your car needs fuel to operate. If you don't have a fuel in your car is not going to start. Not even it can't even start, not even to move an inch. Okay. And even if you have a fuel in your car and you did not fill it up before it goes empty, it's going to stop wherever the fuel runs out. The same thing applies to your body. The sugar is the main is found in your blood and is the main primary source of energy. Okay, the sugar that is in your blood is what propels you, that gives you the energy of most of the things, your life activities, every minute, every seconds, every minute, every hour. It is your source of energy. And when that energy is used or depleted, you start getting some symptoms of weakness, tiredness, and dizziness because your energy has been depleted and need to replenish back. And that's where comes about carbohydrate. That is why I say any diet that does not include carbohydrate is not a balanced carbohydrate. Every diet must include carbohydrate for it to be a balanced diet. Okay? So, blood glucose or blood sugar is the main sugar found in your blood. It is your body's primary source of energy. Okay? It comes from the food you eat. We obtain that energy from the food we eat, and then your body breaks them down. Okay, break most of those food into glucose and then release it into your bloodstreams. And that is what I said yesterday. As you derive or get your this energy in most of the food you eat, and that is why I said any diet that does not include carbohydrate is not a balanced diet. Despite you are diabetic and they say you have to reduce the intake of carbohydrate in your diet and then increase the fiber in them, does not mean you should stay away from carbohydrate. Your body needs carbohydrate to sustain you on every seconds of your life. So any diet that does not include carbohydrate is not a balanced diet. your meals must contain carbohydrates. Now, the question is that as a diabetic, you have to know how to count the carbs. How many carbs should I have in every meal that I eat for it to be a balanced diet? That is how you start counting your carbs as a diabetic. If you are not a diabetic, that's a different time. You don't need to count the carbs, just eat your food. All right. So now those carbohydrates that you consume, once it gets into your system, your body now convert those carbohydrates into source of energy, convert them into sugar, and then release them back into the bloodstreams. Now, the effect those carbohydrates will have in your bloodstream depends on the amount of carbohydrate you consume. That is why, as a diabetic, you have to reduce the amount of carbohydrates so that when you consume them and your body now converts them into energy, it's not going to affect your sugar level to spike up. Because once it converts those carbohydrates into energy, it's going to release them back into your bloodstreams. Now, the difference of spiking up depends the amount of carbohydrate you consume. The larger the amount of carbohydrate you consume, the higher it's going to spike up your sugar level. The less amount of carbohydrate you consume means it's not going to affect your sugar level. Okay? So your body breaks them most of that food into glucose and release it back into your bloodstream. Now, when your blood glucose goes up, it signals your pancreas to release insulin. So as soon as you eat, for instance, those that are healthy, that are not diabetic, once you eat those large food and then your sugar rises up, it's going to trigger your pancreas to release the insulin to do its work. Okay, into your bloodstream. When your blood glucose goes up, it signals your pancreas to release insulin. Now, insulin is a hormone that helps the glucose get into your cells to be used for energy. So what that insulin does, what it moves the excess sugar that was in your bloodstream back into your cells to be stored as energy and to be released back into your bloodstream when you need it. So it mops up those excess energy in your bloodstream, the sugar in your bloodstream, and then store them into your cells, your liver, your tissue, your muscle tissues, and stores them there and then release them back into your bloodstream. So that is what is called, okay, glucose. So this is the definition of glucose. Okay, that is the definition of. So now this is the definition of blood glucose, and then we're going to now define what is diabetics, because you have to understand there's a little difference between blood glucose and diabetics. So this is what blood glucose are. There's a little. When I say little, there's a thin vein line between diabetics and glucose. They are all the same thing, because when you have too much, if your pancreas fails to work, and then you have too much accumulation of sugar in your bloodstream, it's going to make it to be diabetic. So there is a very thin line between blood glucose and diabetics, and that is what we're going to differentiate and discuss now. So this is what the definition of blood glucose, which is at times called blood sugar. Okay. So we now understand the definition of what is blood glucose. There's a difference between a blood glucose and diabetics. It's just a thin vein line. So I'm going to try to differentiate both of them in terms of definition. So you have to differentiate both of them. What do you understand by blood glucose and what do you understand by diabetic? Okay, so now we're going to talk about what is diabetics. All right. So let me get this thing out. So we're going to discuss about what is diabetics. So now I'm going to discuss, now that you understand what blood glucose is, now that we understand what is blood glucose, now let's define what is diabetes. There's a difference between blood glucose, blood sugar, and diabetics. There's a there's a thin line between both of them. What is blood glucose? What at the same time called what is blood sugar? What is blood sugar and what is diabetics? They are two different things, but the difference is just a small difference. I've given you guys the definition of what is blood sugar and what is diabetics. So let's discuss what is diabetics. Okay. Diabetics is a disease in which your blood glucose levels are too high or too low. I want you guys to understand now. Okay, I've defined what is blood sugar. There's a difference between blood sugar and diabetics. Now I'm defining what is diabetics. Okay, diabetics is a disease in which your blood glucose levels are too high or too low. Okay, now let me just stop here and let me go back to blood sugar. What is blood sugar? Let me define it. Blood sugar is the main sugar found in your blood. It is your body's primary source of energy and it comes from the food you eat. Your body breaks down most of that food into glucose and then release them back into your bloodstream. When your blood glucose goes up, it signals to your pancreas to release insulin, and then the insulin goes to work to help the glucose get into your body cells to be used as energy. The primary source of blood glucose is for your body to use them as energy. When your body breaks down those carbohydrate glucose, the primary source of those blood glucose or blood sugar is for your body to use it as a primary source of energy. Like a car uses a fuel as a source of driving. So the primary source of the carbohydrate you eat, or the primary source why you should have a blood sugar is as a source to use it as a source of energy. That's what is blood sugar. But when that blood sugar is not being stored into your cells, tissues, and liver to be used as source of energy, rather it stays in your bloodstream and keep accumulating high, high, high. That is when it becomes diabetes. I don't know if you guys understand my definition, my difference. The primary source of blood sugar or blood glucose is to be used as a source of energy, so that using when you are running, you are using your energy. When you are farming, you are using. When you are cutting, when you are talking, when you are doing a lot of things, you are using those energy. The main reason why we have blood sugar is to be used as a source of energy. And when you consume that carbohydrate, okay, when you are not diabetic, and it goes above the normal level, it signals to your pancreas to release insulin into your bloodstream to mop out those excess sugar to be stored into your cells to be used as a primary source of energy. Then, when your pancreas fails to release insulin to your bloodstream to do its primary function, when it fails to release insulin, or it releases insulin, but that insulin is not enough to mop out all those excess, to mop up those to mop up those energy, those blood sugar to be stored into your cells, tissues, muscle tissues, or your liver. When it fails to perform that function, instead those blood sugar keep accumulating in your bloodstream. That is when you become diabetic. See the two different things? So let's go back to what is diabetics. That is blood sugar. What is diabetics? Diabetics is a disease in which your blood glucose goes too high or goes too low. When you have diabetics, your body doesn't make enough insulin. Okay? Can't use it as well as it should be, or both. It's either it doesn't make enough insulin or it cannot use that insulin correctly. So what happened? Too much of glucose stays in your blood and doesn't reach the cells where it's supposed to be. So over time, those accumulation of sugar in your bloodstream, okay, becomes a problem. And that is what is called diabetic complications. You become diabetic. Okay? So too much sugar, too much glucose stays in your blood and doesn't reach your cells. Over time, having too much glucose in your blood can cause serious health problems, diabetes complication. So if you have diabetes, it is important to keep your blood glucose level within your target range. So you see the difference. As I said, there's a difference between blood sugar, blood glucose, and diabetes. Every human being is supposed to have blood sugar because that is your primary source of energy. Okay? It's supposed to give you, that is where you get all your energy used. And when your blood sugar crosses the threshold and goes higher, it signals to your pancreas to release insulin to the bloodstream to mop out those excess sugar and store them into your cells. But failure for your pancreas to perform its function, it is not releasing enough insulin, or it releases enough insulin, but your body can't use it correctly to do its function. Rather, the sugar in your blood keep accumulating, and keep going higher. That is when you become diabetics. So these are the two different things. Okay, so if you have your blood sugar normal, you might have, every human being have their blood sugars, and they are not diabetics because your pancreas is performing its function. But if your pancreas is not performing its function, then that is where it becomes a problem. So now that I've differentiated the two, what is blood sugar and what is diabetes? Okay, so I'm going to post this. I'm going to post it, and you guys should read it. Then I'm going to change it. So let me go back to the blood glucose. Let's go back to what is blood glucose. The definition of this is, I'm going to allow it for 2 minutes for you guys to read it. What is blood glucose? Then I'm going to post the diabetes aspect of it. Okay. All right. That is the definition of what is blood sugar. So now I'm going to post what is diabetes. As I said, there are two different things. Okay. Now that you read what is blood sugar, let me post what is diabetes. Okay. This is what is diabetics. So this is what is diabetics. Okay. As I said, I'm going to be discussing blood sugar, high blood pressure, and cholesterol. Okay. So that's the definition of what is diabetics. There are two different things. If you have any question, feel free to ask. Okay. Now I'm going to go into uh, high blood pressure. I'm going to go into high blood pressure. Okay. Let's talk about high blood pressure. Do you guys have any question before I move on? Ask your question before I move to the next one. I'm going to talk about high blood pressure. Okay. I'm going to talk about blood pressure now. All right, I'm going to remove this and then we'll talk about uh, what is, let's talk about what is blood pressure. Let me post it. What is blood pressure? So now we're going to talk about what is blood pressure. So as I said, I'm going to be discussing the three of them at the same time. I'm going to be talking about blood sugar, high blood pressure, and cholesterol. So I'm going to be discussing the three chronic illnesses at the same time. So any question, you guys can ask me any question on any of the topic. So what is blood pressure? You guys have been hearing about blood pressure, blood pressure, blood pressure. What is blood pressure? Okay. Blood pressure is the force of your blood pushing against the wall of your arteries. Okay. Blood pressure is the force of your blood pushing against the wall of your arteries. Okay. Any question? So now is the pressure of your blood pushing against the wall of your arteries. Now, each time your heart beats, each time your heart beats, it pumps out blood into the arteries. And the highest, your blood pressure is highest when your heart beats. Blood pressure is the pressure of your blood when it's pushed against the wall of your arteries. And again, each time your heart beats, it pushes out blood. Now, your blood pressure is high when your heart beats. Okay? So, when you have when your blood pressure is too high or too low, there are different consequences that comes with it. Okay? So, you guys might have heard about we have the systolic and the diastolic. Okay? As I said, your your blood pressure is highest when your heart beats pumping the blood. Now, this is called systolic, okay, pressure. When your heart beat is the high, that your blood pressure is high when your heart beat, okay, pumping the blood, and that is called systolic pressure. When your heart is at rest between your beats, for instance, this is your heart, okay. When it beats, your blood pressure is high, pumping blood. When it rests in between the beats, okay, your blood pressure falls, and that is called diastolic pressure. So when your heart beats, your blood pressure is high, pumping the blood. The time in between the beat and the rest, okay, of your blood pressure is low, it falls, and that is what is called diastolic pressure. So you might have about systolic pressure and diastolic pressure, okay. So that is how you read your blood pressure within those two, the diastolic and the systolic. Usually the systolic number comes before or above the diastolic. The diastolic is at the bottom, the systolic is at the top. Okay, so that is what is called blood pressure. Okay, so you guys have known the definition of blood sugar, diabetics, and then now this is the blood pressure. I'm going to post it here for you guys to see the definition of blood pressure. Okay, that is the definition of blood pressure. What is blood pressure? Blood pressure is the force of your blood pushing against the walls of your arteries. Each time your heart beats, it pumps blood into the arteries. Your blood pressure is highest when your heart beats, pumping the blood. This is called systolic pressure. And when your heart is at rest between the beats, your blood pressure falls. This is called diastolic pressure. And we use systolic and diastolic to measure your blood pressure, if it is too high or too low. And when your blood pressure is too high, there are consequences. And when your blood pressure is too low, there are consequences. The same thing regarding your blood sugar. When your blood sugar is too low, there are consequences. And when your blood sugar is too high, there are consequences. And we're going to move into cholesterol. We're going to discuss about cholesterol. Also, when your cholesterol is too high, there are consequences. Below, there are consequences. So that is why I call it, these are the threes. I'm discussing the three chronicles or the three chronic illnesses. Those are the complication of diabetics. Okay. So I hope you guys, if anybody have any question, feel free to ask. Okay. If you guys have any question, feel free to ask. So now we've defined what is blood sugar, we've defined what is diabetics, and we've defined what is blood pressure. So let's go now define what is cholesterol. Okay. Let's define what is cholesterol. All these are all interwoven. They are all linked to diabetics. They trigger one another. If you don't control this, it's going to trigger the other one. If you don't control this, it's going to trigger the other one. So you might be having three of them at the same time. And they all causes us a lot of health hazard if not controlled. If you're not treating all of them, it's going to cause you a lot of complications or even fatal. It's going to cause you to lose your life. So let's discuss what is cholesterol. Let me type it. What is cholesterol? Okay, what is cholesterol? So now we're going to be defining what is cholesterol. Okay. Do anybody know what is cholesterol? Cholesterol are lipids. We call them lipids. They are fats. Okay. Cholesterol are lipids. We call them fats. So cholesterol is a waxy fat-like substance that found in all the cells of your body. Okay. They are found in all the cells of your body, arteries of your body. Your liver makes most of the cholesterols that you use. And it's also in some foods, such as meat and dairy products. Okay, your body needs some cholesterol to work properly, but if you have too much cholesterol in your blood, you have a higher risk of, coronary artery disease, heart disease. Okay, so that is what cholesterol is all about. They are lipids, they are fat, what's like sometimes found in all the cells and arteries of your body. And when it clogs the arteries, the walls of the arteries, it makes pumping of the blood very difficult. Okay, that is why you develop stroke. So it clogs the arteries. They are lipids, they are plaques. Okay, they are found in the cells and walls of the arteries. And when they are there, those waxy substances, they become hardened and narrow the arteries and cells of the body. So now bloods are not flowing properly. So even though your heart is pumping blood, now because of the clogged arteries, it's going to force your heart to work harder. Maybe it's going to work 100 times or even twice the times of a normal heart rate in order to pump blood, force it to go through those arteries to reach your brain. And if blood is not reaching your brain, oxygen is not reaching your brain, that becomes a problem because oxygen is transported through the blood vessels to reach your brain. So anything that's going to stop the flow of blood reaching your brain to carry the oxygen to your brain is going to cause you to have stroke or even sudden death or heart attack. So what those cholesterols do is that they are found in the walls, cells, and arteries. They are waxy like fat-like substances. They are lipids. And when they keep sticking to the walls of your arteries, they keep sticking there, they keep sticking, they keep sticking. When they stick, they are hardened. When they stick, they are hardened. It comes a time that your arteries become narrow. The blood vessels and arteries become narrow. Now, your heart is pumping blood at a normal rate when the arteries are open, so the blood can flow normally and carry oxygen to your brain. So what happens is that when your heart, because of those lipids, those wax fatty-like substances sticking to the walls of your arteries, they are hardened, then it becomes, they narrow the veins, it narrows the arteries. Makes the opening of the arteries to be too small. Now, blood is not flowing through because now this is the normal size of your arteries. Okay, so blood can flow. Your heart can pump blood. It goes easily and carry blood all over the part of the body to the oxygen. Now, when the lipids are forming on the walls of your arteries, okay, what happens? It narrows the arteries to be smaller because now they have formed and fall hardened in the walls. So when they form on the walls, they become thick and hardened. And because they form thick and hardened, it narrows the veins, the cells, and the arteries of your cell. So what happened now? Blood cannot flow through these arteries properly. Okay, because the arteries have been narrowed. So what happened to your heart? For the blood to push through, to go through here, your heart is going to work 4 times the normal rate. It's going to be pumping blood with all forces to push the blood, to force the blood to go through so that oxygen can reach to your brain. So whereby, because of now your heart is working more harder, okay? It's working faster and more harder. You are putting pressure to your heart. That's why some people become stroke, or all of a sudden they have heart attack and then they die. Because now you've put too much pressure on your heart. It's now pumping, forcing the blood to go, forcing the blood to go. And maybe it's forcing the blood is not even reaching to the brain. And because the blood is not reaching to the brain, oxygen is not reaching to the brain. You develop stroke. All of a sudden, you become paralyzed. All of a sudden, you see somebody fall and have heart attack and die because there are too much pressure in your heart because of cholesterol, because of those lipids that forms in the cells and walls of your arteries. So when you hear somebody, you hear, oh, I talked to this person, come to this morning, I saw him this morning, I saw her this morning, we talk, we laugh. All of a sudden, he just left. The next 1 hour, they call you, oh, this person just died. He said, but I just saw the person just now. He just came to my house. We just finished eating now. What happened? He just fell and died. And, African mentality, they say, oh, maybe they have used the black magic on that person. No. How can somebody just talk to now, all of a sudden just slump and die? Most people have cholesterol issues, high blood, and they don't know because the symptoms are not there. The symptoms are too minimal. If you accept you are studying yourself very well, yes, you know your body very well, you can feel some symptoms within yourself to go to the hospital. Some of them will see the symptoms, they keep ignoring it. They keep doing self-medication. They have a headache, they keep drinking painkiller. Oh, instead of them to go and see a doctor, they drink out okay, the headache goes and come back. They drink another headache painkiller, it goes and come back. They drink another one. Those are symptoms. Any symptom that lasts for more than 7 days is no more a symptom. You have to go and see a doctor. It means it's telling you there's something wrong with your body. So maybe they are seeing some of those symptoms, they keep ignoring it. Then it goes from stage 1, stage 2, stage 3, stage 4. And then when it gets to the final stage, it's already too late. And then the person falls and dies. Okay? Or when you start seeing a pain in your chest and they keep ignoring it, you see a minor pain and you can see a pain, it goes and pain in your chest, it goes and come back after a couple of days. You drink painkiller, it goes and come back. When it lasted more than 7 days, stop drinking the painkiller, go and see a doctor. That is a warning. There is something wrong with your chest. And anytime you are feeling pain in your chest, if the pain, because this is where your heart is on the left-hand side, not on the right-hand side. Your heart, every human being heart is on the left-hand side. And that is why if you complain about chest pain, and then doctors, when you complain about chest pain, and then doctor asks you, where are you feeling the pain in the chest? There's a specific reason why he or she wants to know the location. If you say you're having a chest pain on the right, then the doctor might be relaxed and not take it seriously and give you some medication, painkiller to go home. It's going to disappear. But as soon as you mention you're having a pain in your chest, on the left-hand side of your chest, that is going to be taken seriously because that is where your heart is. So anytime you are feeling pain in the left side of your chest, just leave whatever you are doing. Don't even waste time. Rush to the nearest clinic and see a doctor. Okay? Anytime you are feeling a pain on the chest, left side of your chest, the pain keep going, keep going. Don't even wait till 7 days. If the pain keep persistent on the chest of your body, leave whatever you are doing, go to the nearest hospital to be checked out because that is where your heart is. There might be that's a symptom you shouldn't just override. There is something happening to your chest that is developing pain that it needs to be taken care of. That could be between life and death. So anytime you are complaining about chest pain, you go to they will ask you where are you feeling the chest pain. If you say on the right, then they might not take it seriously. But if you say on the left-hand side here, the doctors are going to take it seriously. Like in the Western world, if you go to emergency hospital in the Western world here and you say, I have a chest pain, or even when you call an ambulance and say, look, I have a chest pain, they ask you, where do you have the chest pain? You say, as soon as you mention the left-hand side, they will rush the next available ambulance to your place to pick you up and rush you into the hospital. They will bump you up. They will bump you up to be number one because left-hand side is where your heart is. You go into emergency hospital and you say, there are sometimes, people, because when you go to emergency hospital, you're going to stay there for minimum 8 hours to be attended to. Okay? If you go to emergency hospital here, minimum you're going to be there for 8 hours before you go, because you have to go through process. Because if you go to the hospital, they put you priority depending on what you came to the hospital to say. If you say you have a minor headache, okay, they say it's not serious, they put you behind the line. So people, when they go to the emergency hospital now, they'll just lie to say, oh, I'm having a chest pain. As soon as you mention chest pain, they'll bump you up. So instead of you spending 8 hours in the hospital, you might be there for less than an hour because they want to rush you into the hospital to check out why you're having pain in the left-hand side of your chest. So anytime you are feeling a pain on the left-hand side of your chest, leave whatever you are doing and go to the nearest hospital to be checked out because that is where your heart is. That's have to do with all your cholesterol. Okay? The same thing with your oxygen level. If you are losing breath, if you cannot breathe properly, you are losing breath. You could feel that your oxygen is dropping. Leave whatever you are doing and get yourself into the hospital because that's going to be a sign of major something about to happen. Once your oxygen is dropping, leave whatever you are doing and get yourself to the nearest hospital to be checked out. Okay, so these are the things you have to be aware of. So we've discussed about blood sugar, we discussed about high blood pressure, we discussed about cholesterol. Now, if you look at the blood pressure, I discussed about blood pressure. I haven't discussed about high blood pressure or low blood pressure. I just defined what blood pressure is all about. I just defined what cholesterol is all about. I have not go into the details about good cholesterol and bad cholesterol, which is the HDL and the LDL and the triglyceride. Okay, I have discussed about blood sugar. I've discussed about the definitions of blood sugar and diabetes, but I have not gone into it to discuss about what type of diabetes it is. So everything has to be broken down for you to understand what I'm talking about. So all I'm just saying here, I'm just giving you guys the definition of what blood sugar is all about. There's a difference between a blood sugar and diabetes. And I've discussed to you about blood pressure. Blood pressure and cholesterol. All these are all linkage to diabetes. Okay, so do you have any question? Why are you guys not shooting any questions? Do you guys have any question for me before we proceed? So now, you see, I'm going in cycle. I'm going in cycle. So I discuss one, I move to the next illness. I go to the next illness, and that's what I'm discussing now. I need a question from you guys. So now, let's go back to blood sugar. Okay, let's go back to blood sugar and start all over again. So now you guys understand what blood glucose is all about. You understand the difference between blood sugar and diabetes. So let's dive down a little bit into it. Okay. If you have diabetes, your blood glucose target is in the range. You guys know the typical target, the range your blood sugar is supposed to be. Okay, for it to be normal and above, and when is this not normal? Okay. So if you have diabetes, your blood glucose target is the range you try to reach as much as possible. The typical target is before meal. Okay, before meal, if you're diabetics, it's going to be 80 to 130 milligram per deciliter. Okay, and then 2 hours after meal, it's supposed to be less than 180 milligram per deciliter. Okay, if you are diabetics, okay, so if you have diabetes, your blood glucose target is the range you try to reach as much as possible. The typical target are before a meal is 80 to 130 milligram per deciliter, and 2 hours after the start of a meal, less than 180 milligram per deciliter. If you're diabetics, okay. Um, let's go to. So your blood glucose target may be different depending on the age or any additional health problems you have and other factors. So um, everything depends on your age. Other underlying illnesses you might have will determine what your blood glucose target will be. Like what I discussed yesterday, um, there was what I was saying yesterday in terms of why you are losing weight. There are reasons why you are diabetics and you are losing excessive weight. There are so many reasons. There are so many factors to take into considerations why you are losing excessive weight. All right. So now, do we have any question? Any question? Any question? Everybody. Okay. I'm trying to see if I have. I'm trying to see if I have questions on my on the messages. Do you have any question? Please indicate where you are watching me from. Indicate where you are watching me from. If you have any question, let's go to. Let's go to this. Do you guys have any question? So now that we've discussed, I've given you guys, I try to differentiate the three. We talk about blood glucose, we talk about diabetes, the definition, blood pressure, and cholesterol. So you guys know the difference. Okay, why you must watch out very well about your health status. It's very important you keep a tab on your health status. It's very, very important. You keep a tab on your health status. Okay, very, very important. So that I'm trying to, I got a miss. Somebody sent me a message here. I'm trying to figure out what it is. Somebody sent me a message here. I'm trying to figure out what it is. Let's see. Okay. Trying to see. Somebody send me a message. I'm trying to figure out. You guys have any question? Feel free to ask me any question before I continue. Like, right? I'm waiting for questions, and then we'll take it from there. All right. So the last one I said, I just gave you guys what is the typical range before meal. I said your sugar level before meal is supposed to be 80 to 130 milligram per deciliter. That is 180 to 130 mg slash dl. Okay, that is milligram per deciliter. Then 2 hours after the start of a meal, less than 180 mg slash dl. 180 milligram per deciliter is 2 hours after meal. And as I said, your blood glucose target may be different depending on your age and additional health problems. That's why you are discussing with your doctor. Okay, but typically, as I was discussing yesterday, you losing excess weight might be you have to take into factors, different things into factors while you are losing excess weight. And I give you guys one example. Yesterday was the medication you take. Most of diabetes medication makes you to lose weight, but if there is an excessive weight that you cannot explain, then that's a cause for concern for you to see your doctor and go over it while you are losing the excessive weight. So your blood glucose target may be different depending on your age, and then if you have any underlying illnesses that is preventing you to have a steady target range. So as I said, we're going to be covering all the three chronic illnesses. I'm covering the blood sugar levels, I'm covering blood pressure, and I'm also covering cholesterol. So I'm discussing the three topics at the same time. So when and so you guys know when and how to check your blood sugar levels. Yesterday I did mention check your blood sugar level first thing in the morning as soon as you wake up. Check your blood sugar levels, note it down as soon as you wake up before meal. Okay, check your blood sugar level as soon as you wake up in the morning. Then before meal, check your blood sugar again. 2 hours after meal, check your blood sugar again. The same scenario happens during your lunchtime. Check your blood sugar levels before your lunch and after 2 hours level after your lunch. The same thing, dinner. Check your sugar level before dinner and 2 hours after your dinner. And then before you go to bed, check your blood sugar levels. You have to keep a record on all those things. And I've told you guys, you have to have a booklet to keep all your records, and you have to keep the record with you at all times. When you are leaving home, you must have 2 weeks of your blood sugar levels with you at all times. So in case of emergency and you are rushed to the hospital, with that numbers, doctors will be able to know your health status and know where to start. That could be a difference of saving your life and death. Okay, so it is important you have a booklet. Keep track of your blood sugar levels at all times. It's very, very important. If you have diabetes, you are likely need to check your blood sugar every day to make sure that your blood glucose numbers are in your target range. Some people may need to check their blood glucose several times a day. Ask your healthcare team how often to check your blood sugar levels. So I've said that several times. Yeah. Um, so what happens if my blood glucose level becomes too high? When your blood glucose level becomes too high, which is called hyperglycemia, there are some symptoms. There are some symptoms you might have experiencing some symptoms. If Abraham, Takele from Ethiopia, you are welcome. You are welcome. Okay, you're welcome to today's program. Now, so what happens if your blood glucose level becomes too high? When your blood glucose level becomes too high, uh, Norma Zimba from Zambia, you are welcome. Okay, you are welcome. Now, so what happens? What happens if your blood glucose level becomes too high? When your blood glucose level goes above the normal range, you have some symptoms. Symptoms will develop. Okay, there are symptoms will tell you that your blood sugar level is too high. Feeling thirsty is one of the symptoms you'll be experiencing if your blood glucose level becomes too high. You'll be feeling some thirsty. Weakness or tiredness will come. If your blood glucose becomes too high, you'll be feeling some weak or tiredness. The next symptom is going to be headaches. You'll be feeling some headaches. Okay. And the most commonly known symptoms is urinating often. You'll be rushing to the washroom, peeing all the time. You're going to be urinating all the time. Every second, you'll be rushing to the washroom to pee. And then the last is blur vision. You're going to have a blur vision. Okay. You won't be able to see properly, or you're going to be seeing some images double. So you'll be experiencing some blur vision. That's when your blood glucose becomes too high. Okay. Um, so what happens if my blood glucose level becomes too high? High blood glucose is called hyperglycemia. Symptoms that your blood glucose levels may be too high include feeling thirsty, okay, feeling tired or weak, headaches, urinating or peeing often, and blur vision. Those are some of the symptoms you might be experiencing. Uh, Lucky, happy New Year to you. Uh, Lucky, happy New Year. So when your blood glucose level becomes too high, these are some of the symptoms you might be going through. Okay, these are some of the symptoms you might be going through. Happy New Year, Lucky. Now, let's go over to high blood pressure, because as I said, I'm discussing diabetics, I'm discussing high blood pressure, and I'm discussing cholesterol. So I'm discussing three topics at the same time. So let's go over to blood pressure and talk about blood pressure. Now, from my from we've defined what is blood pressure. Okay, uh, we've defined the two ways you can measure blood pressure: your systolic and diastolic. Okay, so now uh, let's talk about high blood pressure. Remember, I just defined what is blood pressure. I did not say high blood pressure or low blood pressure. So now we're going to go into what is how is high blood pressure diagnosed. Now, first of all, let's me mention this to you guys. Your blood pressure reading uses these two numbers. Usually, the systolic numbers comes before or above the diastolic number. So the number that is on top is your systolic number, and the number that is below is your diastolic number. So, for example, 120 stroke 80 means a systolic of 120 and a diastolic of 80. Okay, so that is how you measure your blood pressure. We use two systems, the systolic and diastolic are the two numbers. The systolic is the number on top, and the diastolic is the number below. Now, for those that just joined me now, we've gone already. It's about 1 hour. I'm here. I've defined what is blood pressure. I've defined what is blood sugar. I've defined what is diabetics. There's a difference between diabetics and blood pressure. There are two different things. What is blood sugar and what is diabetics? They are two different things. So I've defined those things. And maybe when I post the video, you guys should watch the video from the beginning and then see the difference between what is blood sugar and what is diabetics. And I've defined what is cholesterol and blood pressure. So we're not going to go back. We have to continue. So now, how is high blood pressure uh, diagnosed? That is what we're going to do now. Now, first of all, it starts with the symptoms. Okay, high blood pressure usually has, you see, diabetes, cholesterol, high blood pressure. Sometimes most of these things you might be diabetics for about 6 months to a year. You don't even know because the symptoms are silent. The same thing applies to high blood pressure. High blood pressure has no symptoms. Okay, you might not even know that you have a high blood pressure. It has no symptoms. Okay, the same thing with cholesterol. Sometimes you might not even know that you have a cholesterol issue because the symptoms are minimal. You cannot say it, except you are a kind of person that pays more attention to your health, to your body, that knows when something is amiss in your body, you can tell and say, you know what, I'm not feeling too fine. There's something wrong with my body. Let me go and see a doctor. Okay, so high blood pressure usually has no symptoms. So the only way to find out if you have it is to go and get a regular blood pressure check from your doctor. That is why anytime you visit your doctor, they will take a blood, they check your blood pressure to make sure if you have a high blood pressure issue, and they will take your height measurement and your weight. So every visit to your doctor, they will take your blood pressure. So usually high blood pressure has no symptoms. So the only way to find out if you have it is to go and get a regular blood pressure check from your healthcare provider. Now, your provider will use a gauge, is a cystoscope or called electronic sensor, and a blood pressure cuff. He or she will take two or more readings at a separate appointment before making a diagnosis. So when you go, they put a cuff on your arm, either the right arm on the left arm, and then when you are checking your blood pressure, you have to be steady. You can't be moving around. You got to sit down, relax, just relax. Don't think of anything, and then they will check your blood pressure, either using a cystoscope or electronic sensor. Uh, to check your blood pressure, and that has been taking two different visits to be able to diagnose if you have a high blood pressure or not. So now I'm going to talk about the systolic blood pressure and the diastolic blood pressure. I'm going to give you guys what is normal, what is high blood pressure, uh, okay, and when it becomes dangerous. All right. So these are the things you have to know, that high blood pressure has no symptoms that you can say this is the symptoms. Sometimes you might have a high blood pressure and you don't even know that you have a high blood pressure. So it comes with no symptoms except when a regular visit to your doctor, they will find out that you have a high blood pressure issues. All right. So do we have any question? Any question? Any question? Any question? And everybody is enjoying still in the merriment of New Year. So um, probably you guys are going to watch this later. Do we have any question on today's topic? Now, let me, how am I going to put this for you guys to understand? I'm waiting to see if you guys, anybody has any question for me. Oh, okay. Now, let's talk about high blood pressure. Okay, the normal high blood pressure when you have no any other heart risk factor. Okay, let's talk about that. What is your normal high blood pressure? What is your normal high blood pressure? Okay, your systolic is supposed to be less than 120. Well, I'm not talking about your normal high blood pressure when you don't have any heart related illness. Your systolic blood pressure is supposed to be less than 120, and your diastolic is supposed to be less than 80. So 120 stroke 80 is supposed to be your heart normal high blood pressure when you don't have any other heart cardiovascular disease or issue. Your systolic is supposed to be 120 and your diastolic is supposed to be 80. So 120 stroke 80 is supposed to be your normal high blood pressure. So when you have then your high blood pressure when you have a other factors or when you have a heart related disease. Okay, when you have a heart related disease, your normal high blood pressure is supposed to be 130 or higher or 80 or higher. So 130 stroke 130 or higher or 80 or higher. So 130 stroke 80 or higher. So both or anything above 130 systolic, that is 130 or higher on systolic or 80 or higher on diastolic. So that means when your normal high blood pressure, when you have a heart related illness, okay, so your blood pressure is supposed to be in the range of 130 or higher or 80, 130 in terms of systolic and 80 in terms of diastolic or higher. So 130 stroke 80, okay, supposed to be your normal high blood pressure if you have other heart related conditions. Okay, now when does it becomes dangerous? When does it become dangerous high blood pressure? When you have to seek a medical attention. It's when it becomes 180 systolic or higher and 120 or higher diastolic. So when your blood pressure is 120, 180 stroke 120, okay, 180 systolic, 120 diastolic, it is dangerous. That is when you have to see a doctor to find out why your high blood pressure is so high. It becomes so dangerous that anything can happen. Okay, so that is when these are the readings when you should see a doctor when you have dangerously high blood pressure above 180, 80 or higher, or 120 or higher in terms of diastolic. Okay, so those are the numbers you're supposed to have in your range. Okay, okay, all right. I'm going to like to take some questions and see what questions do you guys have. Let's see if you guys have any question, and then we'll take it from there. Type 1 from 2007. Norman Zimba says, I'm type 1 from 2007 on insulin. Does it mean that there are side effects of insulin because I feel bad when I'm checked every time? Every I feel bad when I'm checked. Everything is okay. Uh, Norman, your question is confusing. You can't be feel bad when you are checked and everything is okay. How can you feel bad? So your question is confusing. Can you ask that question again in a different way because you can't feel bad and at the same time okay at the end of it when everything is okay. So how are you feeling bad when you are being checked, everything is okay? So I'm confused. Your question. Can you refer? Can you ask that question in the way I can understand it? I know you say you are type 1 from 2007 on insulin. Does it mean that there are side effects of insulin? Every insulin, medications have side effects. Okay, medications in general have side effects. Some it depends on an individual. Some individual might not have that side effect. Some individual might have side effect on certain medications. Okay, so in general, too much of insulin in your system is too bad, and when you have low insulin, also is not good. So excessive insulin in your blood is too bad. So I think if there's one video when I've checked my page, I've done a video about on insulin. When you have too much insulin in your system, there's side effect of too much insulin in your system. And when you have low insulin, it's going to also have a problem because when you don't have enough insulin, it's not going to help you to regulate your sugar in your bloodstream. Okay. Then having too much insulin in your system also comes with side effects. Okay, but Most medication comes with side effects, but it depends on individual. There's some individual that doesn't have side effect on that particular medication, and there are certain individuals that have side effects on the medication. So if you are taking any medication and have side effects, you have to go back to your doctor and tell your doctor, I'm having side effects on this medication. Can you change it for me? The doctor is going to change it for you to give you something that is not going to have side effects. Okay. So any medication you are taking that have side effects, go and see your doctor to change those medications for you. Okay. But I know you say you are type 1 since 2007 and your insulin doesn't mean that there are side effects. If you are taking the insulin and you are not having any side effect, then you are okay. But if you are taking the insulin and you have side effect, you have to go back to your doctor and let your doctor know that I'm taking this insulin, I'm having side effect. Can you change it to another? There are different kinds of insulin. So he might change it to another insulin that and ask you to go and try it. And maybe that insulin is going to be better for you. Okay? Because I feel bad when I'm checked, everything is okay. So that's why when you say everything is okay, it's where I'm getting confused. So you are type 1 since 2007, your insulin, but when you are checked, you are feeling bad because you are checked. That's why you are feeling bad. But after that, you are okay. You see that you're okay. So, you know, are you feeling bad because you are checked all the time? But at the end of it, you are okay. So that means your insulin is working. It doesn't give you any side effect. So why are you feeling bad? That's why I say I'm confused in your questions. But if you are having side effect in your insulin, try to see your doctor again and then let your doctor know that you're having a side effect on this insulin. The doctor is going to recommend another insulin for you that is not going to give you any side effects. Okay, if you are not having any side effect on this insulin you are taking since 2007, then there's no reason for you to feel bad because that means because at the end of the day, you say you have when they check you, you are okay. It means that insulin is working. So the only thing you have to feel bad is that you're diabetic. Okay, so fortunately, you have to live with it and manage it properly. Okay, I hope I've answered your question, except you're going to ask that question in another way for me to understand. All right. If you're having side effect with that insulin, you have to go back to your doctor and let your doctor know that I'm having a side effect to change that insulin for you. There are different kinds of insulin that might not give you side effect. Okay. Now you say you are feeling bad because you are checked, but at the end of it, you are okay. So don't feel too bad that you are checked because they are trying to save your life. It depends on what you are being checked for. Okay. So I hope I've answered your question. Do you have any other question? All right. So um, the most serious side effect of insulin is the most serious side effect of insulin is hypoglycemia. It causes you to have a low blood sugar. So that's the most serious side effect of insulin, hypoglycemia. That is low blood sugar. Okay. So if you are having a low blood sugar because of that insulin reaction, uh, you have to report to your doctor to be treated immediately. The most serious side effect of insulin is hypoglycemia, which is low blood sugar or insulin reaction. And the symptoms of low blood sugar must be treated before they lead to unconsciousness. So anytime you're having a low blood sugar, you know what to do. You have to boost it up before it leads you to have unconsciousness or passing out. So different people might react differently on the symptoms of low blood sugar. So if you have a low blood sugar, that symptoms of low blood sugar must be treated before it makes you to pass out or become unconscious. You don't want to have a low blood sugar. So that is the most common dangerous aspect of serious side effect of insulin. It's going to make you to have low blood sugar. Okay. So you have to treat the symptoms of low blood sugar before you become unconscious or passing out. All right. Gloria, you are welcome. Happy New Year. I believe you enjoyed your New Year celebration in Nigeria. All right. Happy New Year. All right. Norma, good that you heard me. So, as I said, you got to watch out. If you are having a low blood sugar, that is the most serious side effect of insulin. If you're having a low blood sugar, which is called hypoglycemia or insulin reaction, that symptoms of low blood sugar must be treated before it makes you to be unconscious or passing out. So anytime you're having a low blood sugar, you know what to do. You have to boost your sugar level up to bring it up to the normal level. Otherwise, if you have further too much low blood sugar, you might pass out. Okay, so just have that in mind. Now, some side effects can be serious, but I'm going to mention some symptoms of some side effects if you're taking insulin. I'm going to mention some symptoms of side effect of insulin. Okay, since you've asked that question, Norman, I'm going to mention some side effect symptoms of insulin. And if you have any of these symptoms and you're taking insulin and you're having that side effect, you must report to your doctor immediately. You must report to your doctor immediately. One of the symptoms of or the side effect of insulin is rash or itching of the whole body. When you have rashes all over your body or your body is itching you, then you have to report and you are taking insulin. That means you're having a side effect of that insulin. You have to report to your doctor immediately. Shortness of breath. Shortness of breath is that means you are losing oxygen. And I've said it before, and I'm going to repeat it again, and I've said it several times. If you are anywhere, you are doing anything, I'm going to be sarcastic now. And I believe there's no children around you listening. If you have a child, ask your child to step away. If you have a child sitting around you listening to this video, ask them to step away for just a minute. I'm going to talk about shortness of breath. That means you are losing oxygen. If you are doing anything, and you are losing oxygen, you are experiencing shortness of breath. Even if you are making love and you experience shortness of breath, stop that making love and get yourself into the hospital immediately because you are living between life and death. It's as simple as what I can say. If you are experiencing shortness of breath, that means you are losing oxygen. Your oxygen is coming down. Okay? Leave whatever you are doing and get yourself to the nearest hospital to check that because you are living between life and death. That's a son of what? That's a warning. That's why I say if you have a child sitting near you, let them step away for me to say what I want to say. And I'm not going to repeat it anymore. Shortness of breath is dangerous. Then wheezing. Wheezing, if you are wheezing, we all know what wheezing is all about. Okay. Dizziness is another side effect of insulin. Blurred vision. If you are seeing a double images, you can't see properly. Fast heartbeat. Your heart is beating faster than normal. Sweating, you are sweating abnormally. Okay. Difficult breathing or swallowing. Difficult breathing goes along with shortness of breath. But if you find it very difficult to breathe or swallowing, these are some of the side effects that are serious. And you are taking insulin and you are seeing these symptoms, you have to see your doctor immediately or go to the nearest hospital and talk to the doctor so that they can change that insulin or stop you immediately from taking that insulin and recommend another thing for you. So these are some of the side effects of insulin, and those are the symptoms. Okay. And then the most serious side effect of insulin, the most serious side effect of insulin is low blood sugar. When it knocks down your sugar level goes down very well, you must treat the symptoms of the low blood sugar before you pass out or become unconscious. Okay? So if you are the most serious side effect of insulin is low blood sugar, which is hypoglycemia. And if you're experiencing hypoglycemia, low blood sugar, you have to treat the symptoms of low blood sugar before they lead to unconsciousness or passing out. And how do you treat the symptoms of low blood sugar is you have to boost your sugar up. That is when you have to find anything like Coke, Fanta, biscuit, chocolate, take, wait for 20 minutes, it's going to boost your sugar level up, and then you'll be okay. Okay? So that is it. Now, Norma says, I feel dizziness and sweating too much. Okay, so you are having that side effect, then you have to discuss it. You have to discuss that with your doctor. That listen, I'm having since I've been taking this insulin, I've been having this side effect, and it's uncomfortable for me. And doctor, they are going to change that insulin for you. So if you are feeling dizziness and sweating too much when you take that insulin, then you have to see your doctor to recommend another insulin for you. All right? Okay. So that is my advice to you, Norma Zimba. Okay. All right. Now, any other question? I've dealt with the shortness of breath. Before you guys join me, I was discussing three topics today. I was discussing about blood pressure, blood sugar, cholesterol. I'm discussing everything at the same time. And I've tried to differentiate between blood sugar and there's a difference between blood sugar, blood glucose, and diabetes. Those that I differentiate them in the beginning of this program. Those that didn't start with me at the beginning of this, because this is about 1 hour 30 minutes I've been here now. So you're gonna wait till when I download the video. You have to start from the beginning to watch the video again, and you can see the different definition, the differences between blood glucose or blood sugar and diabetics. They are two different things. Okay. All right. So what am I talking about? Insulin. So I'm gonna go over to let's go over to cholesterol. Let's talk about cholesterol a little bit. Okay. Um, we've discussed, I've defined what cholesterol is all about. Okay. I've defined what cholesterol is all about. So now, how do you measure cholesterol levels? And we have we have two types of cholesterols. Okay. We have the good cholesterol, we have the bad cholesterol. And how do we measure cholesterol levels? Okay. A blood test called a lipoprotein. You do a lipoprotein test, a lipoprotein panel test. That's how you measure your cholesterol levels. They send it for lipoprotein panel test to measure your glucose test. How do you measure? Let me put it here. Feel free to ask your questions. If you guys have any questions, feel free to ask your questions. How do you measure your cholesterol levels? So, how do we measure our cholesterol levels? Is what we are going to discuss now before I round up. I don't want to, today is New Year. I'm not going to be, I wanted to stay here for 30 minutes, but I've been here for almost getting to 2 hours now. So, uh, how do we measure cholesterol levels? As I said, a blood test called lipoprotein panel test, a lipoprotein panel test can be used to measure your cholesterol levels. And before the test, you need to fast not eat or drink anything but water for 9 to 12 hours. And then the test give information about your cholesterol levels. Okay. Um, I feel dizziness. How do you measure your cholesterol levels? A blood test called a lipoprotein panel can measure your cholesterol levels. Before the test, you need to fast, not eat or drink anything but water for 9 to 12 hours. And the test gives you about your cholesterol levels. Now, on your cholesterol test, there are 5 things they check to see if you have a cholesterol issues. They check your total cholesterol. They check your your bad cholesterol, which is the LDL. They check your good cholesterol, which is your HDL, and they check your non-HDL, and they also check your triglyceride. Your triglyceride plays an important role to determine if you are having a cholesterol issues or not, or any heart disease. Okay, so they use total cholesterol, your LDL, HDL, non-HDL, and your triglycerides. All these are used. They need these numbers to confirm. The doctors look at these numbers to check if you are having any heart-related issue or you have a cholesterol issues, and then they recommend treatment for you. So, what is total cholesterol? Total cholesterol is a measure of total amount of cholesterol in your blood. It includes the low density protein, which is your LDL cholesterol, and the high density protein, which is your HDL. Okay, which is your HDL. Okay, so that is what they use to check your cholesterols. And let me remove this. Let me remove this one again. Let me go remove this. Do you have any question? So, how do you? I'm talking about how do you measure your cholesterol levels, and I says your cholesterol levels. First, they check your total cholesterol. A total cholesterol is a measure of the total amount of cholesterol in your blood. It indicates both low density lipoprotein, which is your LDL, which is your bad cholesterol, and they also check your cholesterol high density lipoprotein, which is your HDL, which is your good cholesterol. Now, let's um, I'm going to explain it in this way for you guys to understand how diabetics and cholesterol, how you develop cholesterol issue or have a heart related issue. I'm going to demonstrate it this way for you guys to understand very well. Okay. Now, let's me so the first one is the total cholesterol, and the next one is the LDL, which is your bad cholesterol, the main source of cholesterol buildup and blockages in the arteries. Why your HDL cholesterol? Okay, HDL helps to remove the cholesterol from your arteries. So your LDL is the one that causes you to have a cholesterol issue because it causes blockages in the arteries, in the walls of your arteries, and become hardened. And when it becomes hardened, the flow of blood is inhibited. Flow of blood cannot be performed properly. It means you are putting more pressure on your heart to pump the blood through those narrow arteries. So your LDL is the one that causes you a lot of problems because it blocks the arteries. There's a blockage, there's a play. Those lipids, those waxy fat lipids block the arteries, it narrows the arteries. And when the arteries are narrow, the flow of blood, okay, because now the arteries are so narrow, it is not wide that the blood can flow easily. So because of those lipids, it narrows the arteries, becomes so narrow. So now the flow of blood, your heart have to work extra hard to pump blood through these narrow arteries to reach your brain. Okay, so the LDL is what causes you the problem, while the HDL is the good cholesterol that removes the cholesterol from your arteries. It doesn't stick to the walls of the arteries, it removes them. The failure to remove them causes you to have a bad cholesterol. And how do you have a bad cholesterol is what I'm going to illustrate for you guys now. Now, you cannot have a bad cholesterol without your triglyceride. Okay, so these are the things they check. I'm going to explain to you guys how you have bad cholesterol, how you develop, how your diabetes causes you to have bad cholesterol or have a cholesterol issue or have heart related issue. I'm going to let you guys understand how it happens. Now, so how do they know you have a heart problem or a cholesterol issue? Is your total cholesterol, your LDL, your HDL. They look at the numbers, and they look at also your non-HDL and your triglyceride. Okay, they also look at your non-HDL. So they look at your non-HDL. This number is your total cholesterol minus, okay, your HDL. Your non-HDL include your LDL and other type of cholesterol, such as your VLDL, very low density lipoproteins. Okay, so your non-HDL, then this number include your total cholesterol minus your good cholesterol. Your non-HDL include your bad cholesterol, which is your LDL and other type of cholesterol, such as your VDL, that's a very low density lipoproteins. Okay, and then the last one is your triglyceride. Your last one is your triglyceride. So the last one is your triglyceride, another form of fat in your blood that can raise your risk of heart disease, especially in women. All right. So, so this is how they measure your cholesterol. They use this total cholesterol, your LDL, HDL, non-HDL, and your triglyceride to measure your cholesterol levels. That will determine if your cholesterol is high or low. Okay. All right. So now you know how you measure your cholesterol. And I was trying to say to you guys, how do diabetes cause it? Okay, let me put it in this way that you can understand. Why do diabetes cause you complications? Why do they say avoid complications of other illnesses like high blood pressure, cholesterol? Why do diabetes lead you to have cholesterol or high blood pressure? So I'm going to explain to you now how diabetics lead you to have cholesterol and then high blood pressure. Cholesterol, high blood pressure, they are all the same in the same category. Okay. But now you'll be wondering, how does diabetics, you might be diabetic in your life, you don't have any cholesterol issue, you don't have any high blood pressure, but all of a sudden you become diabetics. And because you fail to control your diabetics, your sugar level, it leads you to become have a cholesterol issue and high blood pressure issue. So how? And I've said it before, okay? I'm going to use this pen, okay? I'm going to use this pen as a mark. This is where your sugar level, normal sugar level is. Okay, this is the, when your sugar level is normal at this point, your HDL is normal also. So I'm going to use my hand as this is HDL, your good cholesterol. Because if your sugar level is normal, this is the bar. This is the bar for your sugar level. That if it goes a little bit high, it becomes high. But when it becomes here in my neck here, it's normal. Anytime your sugar level is at normal, your good cholesterol is at normal. They are the same, they are in the same wavelength. This is your HDL. Okay? This is your good cholesterol. Your bad cholesterol is below. Your LDL is forced down, is below. Your HDL is what is normal with your sugar level, because your sugar level is normal now. Now, if my sugar level goes high, close to my mouth, you see where my sugar level now it becomes high. Once my sugar level goes from normal to high, above the normal level and goes up, it's going to force my HDL to go down. It's going to force my good cholesterol to go down. And then it's going to bring up my bad cholesterol up to be in the same level with my abnormal high sugar. So anytime your sugar level goes up above the normal level, it's going to force the good cholesterol, HDL, to go down and bring up your LDL, which is your bad cholesterol, to become in the same high. So when you have high sugar and bad cholesterol, that is what leads you to have high blood pressure. It becomes so potent because now your sugar level is high, your bad cholesterol is high. These are two bad potent that can cause you to have heart attack, can cause you to even die, because now you have high sugar level, high cholesterol, which is bad cholesterol, LDL. And you know what happened to when you have bad cholesterol? It's going to narrow the arteries of your blood vessels. It's going to narrow them because it's now forming plaques. It's now forming thickness. Those fat lipids, okay, it's going to be forming in the walls of your arteries where your blood flow. And when it forms, it hardens. So anytime it sticks to the wall of your arteries, those bad cholesterol, it hardens and then narrow your arteries to be smaller, smaller, smaller. And when it becomes smaller, the more your arteries where the blood flow becomes smaller, it's going to force your heart to work 5 times harder to pump the blood with force so that the blood can pass through those narrow arteries to reach your brain. Because remember, your blood, your oxygen is transported through your blood. The oxygen is transported through the blood. And if the oxygen cannot get to your brain, it's going to cause you to have what? Stroke or heart attack or even death. Because now you are not controlling your sugar level, it goes high, then the bad cholesterol will now rise up to be in the same with the high sugar level. And then because your LDL is high now, it's going to be sticking in the walls of your artery. And when they are sticking in the walls of your artery now, they are forming thickness. Excuse me. They are forming plaque and thick in the walls. And when they are forming thickness, what is going to narrow the arteries. And when your arteries are being narrowed because of those lipids, those fats, blood is not going to flow through there normally. Now it's going to force your heart to be working extra hard, 2 or 5 times harder to pump blood through those narrow arteries to reach your brain. And in the process of working your heart, you might have heart attack because your heart is overworking over time, or oxygen is not getting to your brain. All of a sudden, you are paralyzed. One of your face is paralyzed because you are not getting enough oxygen. That is how you have cholesterol issue. So the only way to control all those things is, now that you know, is either through medication or you have to bring down your sugar. As soon as your sugar level comes down to normal, constantly remains at normal constantly, it's going to force this bad cholesterol, LDL, to go down to its position before and then bring up the good cholesterol, HDL, in the same level. So for you to control your cholesterol and high blood pressure, you have to make sure your sugar level remains normal at all times. Anytime your sugar level goes high, it's going to force the other one to go down and bring the bad one up. So that's how you control your bad cholesterol, either through medication or through exercise and balanced diet. Because when you're exercising and you're eating healthy, it's going to clean up those, because HDL, which is your good cholesterol, is there now. It's going to clean up those arteries to make sure nothing sticks in the wall of those arteries so that blood can flow properly. And then your heart is not overworking. So exercise, eating healthy, medication will control those bad cholesterol to make sure the walls of your arteries are not left with any fatty lipids in the walls. Okay, so this is how you control your cholesterol issues. Now, if you guys don't have any questions, I'm going to let you guys go. It's almost 2 hours I'm here. My intention was to be here for about 30, 45 minutes. I'm not even supposed to have a video today. But all of a sudden, I said, okay, today is the first day of January. Let me just have a video for the first day of January. Okay, for you at that. So if you guys don't have any question, I'm going to let you guys go, and then send in your questions. You leave your comments, like the video. Okay, give us a thumbs up, and make sure that you share the video to your friends. And then I'm going to see you guys some other time. So, in the absence of any other further questions, I'm going to say to you guys, enjoy your today's first day January holiday at home with your friends and family, and make sure you eat wisely. And then make sure tomorrow is back to work, back to business. Those that are returning back to their base, drive safely when going back to your city, to your base of business or work, and make sure you adhere to information and eat wisely and think wisely. So I'm going to leave you guys now, and I'm going to see you guys some other time. Stay blessed. Goodbye.